Doctors and nurses of Reddit, what's the most blatant lie a patient has told you about why they're in the hospital? Story number 1. Easy. A guy came in complaining of being constipated and couldn't poop for 5 days. He reported rectal blood and difficulty passing gas. CT was done and showed a 9-inch linear object bordering on slightly puncturing through his bowel with questionable free air. With the CT results in, we confronted the guy. 9 months ago, 9 months ago, this guy got out of prison, where he stuck a prison shank in his butt to hide it during a cell search. It was already in there about a year before he got out. He didn't tell anyone for fear of adding on his prison sentence. He was never able to retrieve it and thought it would just pass naturally. He was just hoping we'd give him some prescription strength laxatives and he'd have better luck. He needed surgery. Story number 2. Was in the hospital for kidney stones. Heard this through the curtain in the ER. How did you get those marks on your arms? It's poison ivy. Are you an IV drug user? These marks all line up with veins. No, poison ivy occurs in patches. I have poison ivy. I need benzos. We don't give benzo for poison ivy. Let's go home to whoever was with her. You have a very serious infection we need to assess. Are you sure you haven't been sharing needles? I'm sure, I have to leave. Okay, we need to prepare to discharge. I was sharing a needle with a friend. Story number 3. I'm a paramedic, and it's the ones who deny doing drugs and insist we don't know our job. I had one patient swearing up and down he doesn't do any drugs. He was just sleeping on the kitchen floor while cooking. I said, "Do you know why your mom is crying? She just did CPR on you because you stopped breathing." The patient then admitted to doing some weed and crack and heroin and meth. Story number 4. I've had patients claim to be suicidal in order to be admitted because they was literally hiding from the police. Story number 5. Had a patient convince his wife he got an STD from a dirty toilet seat in the ER when he arrived to the hospital. He was in house for about a week or 2 after his wife dutifully staying with him each day until about 6. She home cooked meals for him every night and will bring them to the hospital each day while trying to file complaints to us for his STD he got from us. The doctor had to kindly explain to her the impossibility of him getting that particular STD from a toilet seat, and it also become active symptomatic in that time frame. She never believed us. After she went home each evening at 6 to cook for him for the following day. His affair partner will show up from 7 to 10 each evening. Story number 6. I've told this story many times before, but when I worked in the emergency department, there was a frequent flyer who will come in complaining of migraines, seizures and stroke symptoms. She was completely full of shit, just wanted drugs and attention. One time, the symptom she presented with was that she could only speak Spanish, but the thing was that in reality, she couldn't speak Spanish. So you had to ask her yes or no questions, or she just wouldn't respond. If the answer was yes, she would say sí, and if the answer was no, she would shake her head, because she didn't know the Spanish word for no is no. Story number 7. I'm an addiction medicine specialist. The patients I treat are detoxing from various substances. The interesting thing is that most of the patients I see are hyper honest. They've been lying to everyone about everything for years. And when they get to me, the floodgates of truth open up. They're so excited to tell the truth to someone, they just let it rip. But there are some exceptions. Some are so used to lying that they do it reflexively. I have had a few alcoholics show up completely wasted and insist they didn't have anything to drink since yesterday or something. This is particularly funny because we literally tell them on a screening call to show up to treatment drunk. Don't want them to stop drinking before they are in our care because untreated alcohol withdrawal is so dangerous. for opioid detox treatment, I generally use a rapid Suboxone taper. Suboxone is an interesting medication. It's highly effective at managing withdrawal once it's started. But if you give it before withdrawal has started, it will start it for you in a violent way. We call it precipitated withdrawal, and it's like going from mostly comfortable to abject physical hell in minutes. It can complicate the process a whole lot, so obviously we try to avoid it. We assess the patients and avoid administering Suboxone until moderate withdrawal has started. This assessment starts with the simple question, when was the last time you used? Occasionally, I'll have a patient who appears completely comfortable. Zero withdrawal, trying to tell me it's been several days since he used. If that's the case, they're either lying or don't need to be in my care. Either way, when I explain the risk of early administration, they usually come clean and say, okay, I used in the parking lot before I came in. The other one I see is people severely understating the amount they drink, mostly because they're embarrassed by it and they think that their disease is uniquely horrifying. They usually open up when I tell them, no matter how much or what you drink, I've seen worse. I've only been wrong about that a couple of times, and honestly, I think it'll be a while before I'm wrong again. The last time I saw a worst case, they had such an amazing level of consumption that I legitimately wanted to study their body and figure out how they are alive. This person was 50-year-old and didn't look a day under 80. I have no idea how they made it to 50. Story number 8. I lied to the hospital staff once before. My ex-girlfriend stabbed me in the hand and it cut me wide open. So I get to triage and I tell them I fell and accidentally cut myself because I didn't want my ex to get in trouble. Yes, I know, I'm an idiot. Blah 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 blah. I've heard it a million times. When I get into a room, I look around and I notice an unusual amount of domestic violence posters on a wall. I thought, that's weird. And the first thing the nurse says is, we know it can be hard to talk about being abused. Like, damn, they were onto me from the start. I still don't know how they knew, but I ended up spilling the beans. They said they wouldn't tell the police if I didn't want them to. That's all for this video. I hope you liked it and had a good time. Thanks for listening.